what Project Echo is. And from once I finish this snippet, then we'll have Danae come in and just greet you all from an LRH or LRHA perspective. I'm sorry. So what is Project Echo? Project Echo, the acronym for Echo stands for Extension for Community Healthcare Outcomes. It is a movement designed to demobilize knowledge and amplify the capacity to provide best practices and care for the underserved people around the world. So not just Louisiana. We're using this for, this effort is going across the country and uh, other countries as well. The model connects primary care providers and specialists on a live virtual platform to share knowledge and expand treatment capacity in rural communities. And what does ECHO look like? So you are officially a part of the ECHO model. We have knowledge that is going to come from our experts who we defined as our hub team. They're a hub team of, they're a multidisciplinary hub team with different knowledge levels related to health disparities, health equity. And you as attendees are going to get to experience and hear from these experts in hopes of you taking the information that you gained from joining us on today in the other 7 sessions. You're going to take and utilize that information and pass it on to the people that you treat in your communities, in your practice. You may use some of this information to make changes on how you do things when you're treating your patients, and just increasing the capacity to be able to envelop more information and be able to see more people in your community. So you're increasing your knowledge. The echo sections function like a virtual grand rounds combined with mentoring and case presentations. You'll hear brief didactic presentations. That's the bulk of your content, but you'll also be able to participate in an all teach, all learn type of environment where you're learning from us and we're learning from you. And so that is how Echo looks. So you are a part of that. So give yourself a hand clap for that. Let's keep sticking. So the Echo framework has 4 parts to it. It uses technology to amplify your leverage to scarce resources. So you are utilizing um, Zoom, which is your software, your technology, to be able to connect with each other. We're going to use case-based learning. So if you did join us, you registered with us, we did ask you to sign up to present a case. And this is used to master complexity. Will the information that we share amongst each other will hopefully be used to increase or share best practices to reduce disparities in your communities. And then we will monitor outcomes. So with you joining, of course, we ask you guys to do a pre-session survey. We're going to ask you to do a post-session survey. And we'll use that information just to identify or to quantify our impact on offering this type of session to you. So how is ECHO used? Initially, when it first started, it was used for prevention, screening, and treatment, which it still is. So you can use ECHO to prevent, to help, I guess, encourage or ignite efforts to for prevention. Using those prevention methods, you can also use it for screening, like when to screen someone for something based on symptoms or previous diagnoses, and then also for treatment, how you're going to move forward with treating that patient or that person. So the benefits of ECHO, of course, again, as stated, prevention, screening, and treatment, but it helps to improve quality and safety. This is a way to rapidly learn best practices, be able to disseminate knowledge amongst the folks that you're on with. It can help you with standardizing healthcare, reduce disparities, which is one of the main focuses of why we are offering this session, and just being able to integrate public health into the treatment paradigm. So there's many benefits to joining ECHO. You can take these benefits and make them applicable to your practice or the efforts that you're trying to move forward in your community or in your practice. So the basic ECHO session structure, this program is going to move rather quickly. It's an 8-week mini session. Most ECHOs usually run monthly or bi-monthly. So this is going to happen in 8 weeks. So after 8 weeks, we'll decide if we're going to move forward or if we're going to just leave it at the 8 weeks. So you're going to join us every week at 12 noon. We'll have subject matter experts. You, of course, as registrants, you're the learners. We're going to use the ECHO model. We'll hold brief lectures, didactic presentations. We'll do case-based learning to create learning loops. And learning loops are just sharing of knowledge between experts and community partners, such as yourself, through active participation in these sessions. So we do want to engage you, but we do want to encourage you to participate as well. This is not just a lecture. We want you to participate and engage with us in this session. And my last slide is regarding iEcho. So yes, you've probably been inundated with email messages, iEcho messages. This is a new way that we are having our participants join. Well Ahead is we're no longer sending calendar invites, which is the old way with the Zoom link. So we're not doing that anymore. You're here because you signed up through iEcho, which is great. But we just wanted to put a little emphasis on it. This platform, it's a digital platform for the ECHO movement to create and manage and run programs in one place. So if you already on for health equity, we do have several other ECHOs that we offer. If you're interested, we have a dental and a diabetes ECHO as well. And we typically, if you're interested in joining those ECHOs as well, you don't have to do a whole new account. You can just be added to those other sessions as well. In 2024, we are required to use iEcho, so there is no workarounds for that. The CME credits surveys will be sent from us, so we will send you that after the session is over, as well as a copy of the presentation slides, but that also will be available to you via iEcho as well. And there are deadlines that can be adjusted. So if you are seeking CME credits, in the follow-up email, we'll have the time frame of when you need to do that survey so you can get those credits, but they do not extend those deadlines. And that is it. So before we start the didactic presentation, I want to have Danae just come in and give a few minutes of her spiel about LRHA and what this project hopes to gain.
Yeah, thanks, Christy. As I mentioned earlier, LRHA is a nonprofit membership association for rural providers, clinics and hospitals across the state. So our mission is to provide a unified voice that promotes and enhances the quality of rural health across the state. And then we have a vision that everyone in Louisiana has access to high quality healthcare and the opportunity to lead a healthy life. And so this initiative we really view as one small step towards meeting that vision of creating equity across the state so that everyone can have access to high quality healthcare no matter where they live and no matter what other factors may impact them as an individual. So we're really excited to partner with Well Ahead on this project. I've worked with ECHO for a long time. I'm a big believer in the model. I'm a big fan of the model. The all teach, all learn approach has proven successful across the world. And so we're really excited to bring all of these folks together. We're excited about our wonderful diverse hub team here to share their expertise. And so we thank everyone for being here, and we're excited to be part of the project, and looking forward to hearing everybody's input and feedback.
Thank you, Danae. We will now move on to the didactic presentation. I'm sorry, Dr. Williams. I gave you remote control so you can move the slides as you need to. We have began recording the presentation, and you will be able to, if you need to, refer back to review the presentation. I am so sorry, I'm stumbling all over my words. We will have it uploaded on our Well Ahead website. And I am turning it over to you, Dr. Williams.
You are muted, Dr. Williams. There you go.
Okay, there we go. I was wondering what happened. It took away the ability to unmute the mic, but that's okay. Christy, thank you so much. Danae, thank you so much. Well Ahead, thank you for this opportunity, and Louisiana Rural Health Association. Thank you so much for just being able to be here. Project Echo, very, very excited about today's topic. What is health equity addressing health disparities? And so I really want to make sure this is engaging. Feel free to, if you want to use your reactions, to raise your hand, to ask any questions, if you want to put any of those questions in the chat as well. So today's objectives, we will be talking about a couple of different things as it relates to health disparities. The definition of health, determinants of health, how do we define health disparities and inequities, and in overall, what does health equity look like? How does it differ from health equality? And just really being able to understand the importance of how for us to achieve health equity. Specifically for all of our healthcare professionals, how can we come up with different strategies for interacting with our patients, for engaging our patients, for providing that care, but looking through a health equity lens? And so this is going to be very, very important as we talk about today's presentation. I really want to also preface you, this is an overview, because throughout the next couple of weeks, we will be diving into some specific topics. And so I'm going to kind of cover an overview about health equity. So, and I should have put this up before and just kind of asked, what is health? So what is health? And just thinking about your overall health, we see that it is defined as a state of optimal well-being. It allows individuals to live fulfilling and meaningful lives. And so, of course, when we look at it, when we think about health, if you could just put in the chat one word that comes to mind when you think about health, because we see it is defined as that state of being free from illness, that state of being free from injury. If you could just go ahead in the chat, and I know, Chrissy, you probably, oh, there you go. You're going to have to help me. I'm seeing quality. One word that comes to mind when you think about health: peace, wellness, being physically fit. Several different topics, and I'm seeing a lot of people are putting well-being. And so wholeness, that's a great one as well. So we see that there are various types of health. I have some listed here. Some people may expand that particular list. A lot of times when you look up the different types of health, the different types of well-being, there are so many different types. So it's not only the physical, it's not only the emotional, but looking at the spiritual, looking at the mental, looking at the social, looking at the environment, looking at the sexual, even going beyond that in terms of when we look at well-being. So before we go into health equity, I just wanted to really have that conversation of us being able to talk about, well, what is health overall? And so what determines your health? So if you could go and what determines your health? What determines your health? And this is very, very important because what we saw with COVID-19, that it disproportionately affected our minority communities, it disproportionately affected our rural communities, our at-risk communities. And so I'm seeing several terms in the chat of what determines your health, from environment to your lifestyle, to different resources, to genetics, to education, some things that are both non-clinical and clinical. So thank you all so much for just being able to provide those particular answers. I also see lifestyle choices. So we see that it is a variety of different things that affect our health. And it's very, very important to know that. And so with that being said, these are the determinants of health. Some, you may have heard it as social determinants of health, in some instances, health determinants. And so this is defined as those conditions in the environment where we are born, where we live, where we learn, where we work, we play, worship, age that affects a wide range of health functioning and quality of life outcomes and risks. And so just hearing from the list that you've provided, there are some things that we don't have a choice about. We didn't have a choice of our birth, in terms of just looking at some of those different factors and just really being able to understand where we were potentially born, the environment that we lived in, the educational factors in terms of maybe our parents or just different things of that sort, all affects our overall health. And so this is important with even to us educating our patients to help us to understand those factors as well. And for us to be sensitive as well as healthcare professionals to our patients. So really being able to make sure that we have a better understanding of what our patients are experiencing. And so when we look overall social determinants of health, many of you said it, it depends on a couple of different factors. Some of those factors could be positive. And if it is positive, it's going to result in health, or it's going to result in that maintenance of health. But then there are some interactions that are negative. And unfortunately, those negative situations, negative interactions, if that's exposure to pollution, if that's making sure that we're not eating healthy and smoking and just different things of that sort, not necessarily having enough money to afford medications or afford healthy foods, all of those different factors are negative and could potentially affect our health. And so that can result in disability. It can result in disease. And then there are also some different factors as well, internal, those characteristics of the individual, which could be potentially inherited or learned. So for instance, in my family, my mom has diabetes. And so there's nothing that I could do in regards to the fact that I have that family history. I already have that family history of diabetes. Now, however, there are some other factors in terms of those external factors, or some of those things that I may do to my body in regards to exercising and eating that I could potentially control, but I can't control the fact that I had that family history. And so just really being able to understand those different factors that overall affect the health, our health as healthcare professionals, and also the health of our patients as well. So I wanted to show you this chart, this great chart from Office of Disease Prevention and Health Promotion, and from the Henry Kaiser Family Foundation. It just really talks about several different social determinants of health. They really kind of bucket it into 5 different areas. So looking at the economy, also looking at neighborhood and physical environment, lumping up access to education and food, and then also, what is that community like? What are those societal factors that may affect a person's health? And then looking at the overall healthcare system. So I'm sure we know we can look through several of these in terms of, and just really being able to have an idea. A lot of times we may not understand certain situations, but looking at this, it shows us that it's so much more to health. There is so much more in regards to what determines a person's health. And so a person may be in a higher socioeconomic neighborhood. They may be in having a higher education. However, that doesn't necessarily mean that they're not going to be affected by other factors that may cause certain injuries, certain disabilities, certain conditions. And so it's really being able to understand all of those nuances, whether it's income, whether it's transportation, whether it's food access and hunger and community engagement, the quality of care that is received, all of that overall affects the outcomes of health. And so we see here at the bottom, these determining factors are going to specifically affect mortality, morbidity, quality of life, life expectancy. And so really being able to have a better understanding of that as well. If we look at the baby in the middle, and this is really just kind of bringing it back to home, is that, hey, you know, even though we have those individual factors, there are other factors that potentially affect us as well. So those other factors individually, someone may be doing what's right. They may be having and engaging in that healthy lifestyle, but there are other factors such as what's happening in our society, what's happening in our community around us, what's happening in the state. Do we have access to, you know, a grocery store? Do we have access to a healthcare provider or a clinic or whatnot within a specific radius of our home? And then overall, worldwide, what is happening? And so it's very, very important to know that all of these play a very, very important factor when it comes to the determinants of health. And so with that being said, let's look at the numbers. So I really wanted to kind of preface you, talk about health, talk about those determinants of health, but specifically, let's look at what we're really facing. And like I mentioned before, the numbers, when we look at chronic conditions, when we look at the increase of prevalence and incidence of just different diseases and conditions, it has heightened. And we saw that with COVID, whereas a lot of people that may not have known that they had a specific condition, it came to light. And specifically, we saw that there was still just a lot of disparities that were occurring. We were even seeing disparities that were happening within our urban and our rural communities as it relates to access to the vaccine, access to different treatment options. And so when we look at the numbers, I just wanted to kind of set this up for you. And these numbers have probably increased. 1.2 million people living with HIV. Nearly 9 out of 10 adults lack the skills needed to fully manage their healthcare and prevent disease. And this is important because a lot of times as a healthcare professional, sometimes we may think or we may assume that our patients are knowledgeable or they know, and that's not the case. And so these statistics show us that there is so much work that we have to do, that we have to make sure that we are sensitive to the needs of our patients, that we are patient in being able to educate our patients and provide them with the necessary knowledge so that they may be able to maintain their health. If you look at this, that third bullet, what was alarming is that 1.6 million people used an emergency shelter or transitional program. And that increased, we saw, tremendously after COVID-19. But what's interesting is 44% of those people were employed. And so that in itself shows that a lot of times we may not know what somebody is experiencing, especially if they're coming into the clinic. So being able to direct them to the right resources, but also making sure that we are taking into consideration what they are going through. And I know a little bit later on, we're going to be talking about cultural competence and some of those other factors as well. This has increased. 6 in 10 adults live with a chronic disease. This is real big when we look at it. I know there's the diabetes echo or whatnot, which is very, very important. But when we look also to cancer, heart disease, diabetes, like these are all chronic conditions that I'm sure we know somebody, whether it's a family member, whether it's our own selves, whether it's a colleague that is experiencing these chronic conditions. And then I wanted to, on this next slide, just to kind of talk about this next column, just looking at some of the other differences or disabilities that we may not necessarily consider or think of or take into consideration when we are managing our patients and being able to care for them. So 37% million have some type of hearing impairment, and 22 million have some type of vision impairment. They may not tell you that they don't know how to read. They may not necessarily tell you that they're not able to hear as clearly, but it's making sure that we have that better understanding. And then this next one, 17 million is not able to walk a quarter mile. I tell this a lot to my students, especially when teaching about nutrition and different things of that sort, because it's almost kind of like it's textbook. They'll talk about the My Plate. They'll talk about all of the different things that you need to eat, da, 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 da. And then after that, I'll say, well, did you notice that that patient was in a wheelchair? Did you notice that that patient had a history of a stroke that may not have allowed them to be able to exercise, like you're saying, 3 to 5 days a week? And so this is very, very important in terms of what we have to make sure that we are looking at against. We're seeing our increase in baby boomers and just really making sure that we're taking care of our patients at this particular time. So I really wanted to kind of bring this to home of, as healthcare professionals, what we're having to make sure that we deal with. So because of that, we know that there are disparities. And so a disparity is defined as a particular type of health difference that's closely linked with social, economic, environmental disadvantages. We know that it disproportionately affects various groups. And so I have so many different groups that are listed here where health disparities adversely affects them. And because of that, I mentioned it before, health equity disparity, it affects all of those different things: length of life, quality of life, rates of disease, disability, unfortunately leading into death, severity of disease, and access to treatment. So really being able to keep in mind, if we have a better understanding of what these disparities are, it can really be able to help us to be able to better manage it, right? And so this is very, very important as it relates to that. So when we see those health inequities, these are differences in health that are systemically rooted, and some of them are unnecessary and it's avoidable. So even at the end of the day, we're seeing these disparities that are occurring. We know that there are so many other systemic inequities that continue to add upon what we're looking at. And so we definitely want to be able to reach a moment where we can achieve health equity. Yes, it's easier said than done, but we are making strides. And so Healthy People 2030, they really wanted to focus within these next couple of years on health equity. They have more of a focus on health literacy as well. And so when we think about equity, this is saying that everybody is attaining the highest level of health. Nothing is coming into account in terms of being a barrier affecting them for having that optimal level of health. But what we see is that health equity, in order for us to achieve it, is going to require a multifaceted approach. It's going to require all of you, us collectively coming together to be able to not only do our part, but us being able to work together so that we can be able to address the health outcomes of our patients. And so I love this chart. I don't know if this graphic, many of you have seen it. Is very, very familiar. When we look at equality, yes, everybody they're standing on the same box. But if you notice, everybody is not able to look on that other side and look through and see what's happening on this baseball field. So when we think about equity, is that what do we need to do to make sure that if I'm lacking or if I'm not having a specific access, that I'm providing that access, or I'm providing whatever is needed to make sure that we are all at an equal plane. And so we're all able to be able to look on that other side. Something interesting also too is that as healthcare professionals, as healthcare providers, as everybody in different sectors, us being able to come from that other side on the baseball field and reach our patients. And that's what's key when we think about health equity a lot of times, because oftentimes we may think of our bubble, we may think of what we're doing, and it's important for us to be able to meet the community where they are, to meet them and address their needs. And so that's taking our knowledge, that's making sure that, hey, if we have to go to their home, if we have to have a phone call, hey, Ms. Joan, I'm just checking up on you. I'm just seeing how you are. I know you came for a visit last week, but I just want to make sure that everything is okay. Going to those health fairs and making sure that we are standing hand in hand in educating our patients as well. So the importance of achieving health equity, we know that it's important in terms of everybody has a human right. And so we definitely want to make sure that we are providing each individual with that highest level of health, regardless of what they may be going through. And I know especially a lot of times we still see that there still is racism. We still see that there is discrimination that is occurring, but we want to make sure that we are able to address those systemic barriers and see how we can make an improvement in the health of our patients. Also, achieving health equity is essential. We know that for overall public health outcomes. We've seen the statistics, and it hurts me so much every time when I look at the stats and I'm sometimes just seeing an increase. I'm like, oh my goodness, what do we need to do to make sure that we are making sure that those numbers are coming down? And so, really being able to develop strategies and solutions, because we know that public health works, but what can we do about it to make sure that we're involved in those aspects of public health? Also, too, ensuring that all individuals have access to timely and appropriate healthcare services. And so when we look at it, everybody is not able to afford specific things. And so, are there patient assistance programs? Are there coupon cards? Are there specific solutions or anything that is going to be helpful to being able to direct them to having that increased access? Um, a lot of times for me personally, even with the patients that because I'm still practicing in the clinic. And so a lot of times, especially if I'm seeing patients that can't afford certain things and it's just a matter of just kind of observing and noticing, but, making that suggestion of patient assistance programs or prescription coupons. I'll even tell them, hey, shop around. You may, if you can't afford certain medications, you don't necessarily have to be locked into one specific pharmacy. Call, see what that cash price is, see what it's going to be with the discount card, all of those different things to help them, because I know that cost is a barrier. I've seen it time and time again, whereas patients will not take their medications because of cost. And so we want to be able to make sure that we are addressing those barriers, we're decreasing those barriers. Also, to importance of achieving health equity, it contributes to a more resilient community. I see this all the time, is that when they know that we care as healthcare professionals and stakeholders, and I say that the community, they care. And so they know that we're invested into their health, and they become trusting of us. They respect us. And so they're open with us in regards to being able to have a more open conversation about how we can help them to meet their needs. And that's very, very important, especially moving forward, kind of still being in a pandemic, but really being able to address a lot of the concerns and health conditions that we're facing. And then lastly, healthcare providers. For those of you who are on this call, we took an oath as a healthcare provider, as a healthcare professional, to say, hey, we want to make sure that we're taking care of our patients, that our patients are at the center of care. They are at the center of attention. And so we want to make sure that we're advocating for equitable access as best as possible. So if something is occurring that you're seeing that is not right, talk about it. If something is occurring that you're saying, hey, I want to make sure that I get involved, or we need to gather, a group of all of us to huddle about it and have conversations about it, let's have a conversation about it. And overall, that will contribute to us being able to decrease disparities and reach health equity. So how can we provide patient care through a health equity lens? I have a couple of solutions, some strategies. Cultural competence. This is very, very important. Understanding your culture, number one, understanding where you come from, your values, your morals, but then also to understanding and respecting those backgrounds and beliefs of our patients and others that we interact as well. And this is very, very key because sometimes we may not understand why somebody is refusing a blood transfusion. We may not understand why someone is refusing contraception or they're refusing some of the other medical advances, but it may be related to their culture. And so if we have a better understanding of what their culture is, it helps us to have a better perspective and it helps us to have better communication as well. So being an active listener is very, very important. Number two, how can we address those social determinants of health? We talked about it. There are so many different determinants of health, but the first step is recognizing that there are so many different factors that may affect a person. So the reason why that patient may have been late to your doctor visit or office visit or whatnot is because maybe they're living 30 minutes away or they're living an hour away. I had that myself. Whereas when we had the Lord and Taylor building, had a patient that was coming from Mississippi. And so not understanding the fact that, wow, they're coming all the way from Mississippi to New Orleans to get care. And so that helped to lay the preface for me to be in a better place of understanding where that patient was coming from. And so, really being able to come up with some different strategies. Maybe that means that we have to provide bus tokens, or we may have to provide access to a lift, or different other things that I talked about as it relates to finances to help our patients. Thirdly, reducing those barriers to access. And this is very, very important, especially when we look overall at healthcare. There are so many different aspects of it. Is multifaceted. When we look at the healthcare system, there are so many different factors as well that we have to work collectively with. So being able to provide that continuity of care, being able to be a little bit flexible in understanding where that patient is coming from. We're seeing an increase in telehealth options. I know this is still a challenge as it relates to our rural communities also too, but there are different resources that are on the rise. And just in general, how can we access different resources for the communities that we're serving and the patients that we're serving so that they are able to better manage their health? Number four, advocating for policy change. And so this is really important too, is that everybody has a part. And just knowing your role and really being able to be engaged in what's going on. So maybe you may not be as knowledgeable about Medicaid and Medicare, but maybe, of course, the patient navigators are knowledgeable. So really being able to pull them in to have a better understanding and being able to educate us as well as educating our patients. So really finding those supportive initiatives that can really be able to increase and just achieve health equity. This next one, biases. We all have biases, believe it or not. Sometimes we may not be aware of it, but that's the first step, is being aware of it, being aware of our own biases. I think that's a topic a little bit later on too, and just really being able to make sure that we are aware of that and just reflecting on it, how we can decrease our biases as well. And then one of the latter ones I want to say, health literacy, knowing that our patients may not have a high level of education. Majority of patients don't. And so really being able to talk about whatever it may be in simple terms, not using medical jargon. We want to make sure that you're just relatable and just being transparent and honest and providing them with resources that is going to assist them. So in that case, if they are not able to read, providing something that has a lot of pictures. So really being able to provide different things that can address or be able to relate to what they are going through as well. And I'm almost finished. I know for time purposes, the last two things that I want to talk about is engaging in community partnerships. Understanding that this is going to take a collaborative approach, not just us that are here, but making sure that we walk outside wherever we are and collaborate with others and partner with others, obtain more knowledge and expertise, obtain additional resources that can help our patients. And then lastly, when we look at overall, we have to track what's happening. That's how we know about the statistics. So really being able to understand and see what's happening and observing that data, and how can we utilize that data to be more effective in our education and in our community, our communication efforts, as well as being able to advocate for those efforts as well. So lastly, you've heard all of the different things that I've talked about as it relates to health equity, as it relates to health disparities. I think one of the things, just to kind of sum it up instead of reading everything on this slide, is that we know that there is work that has to be done. And so each and every one of us have to make sure that we play our part, that we understand our role in addressing health disparities and achieving health equity. And we make sure that we utilize all of the resources that are within our reach, collaborating with others to make sure that we are able to provide the best health outcomes, healthcare to our patients so that they can achieve those best health outcomes. And with that being said, that I'm going to open up the